Hi everyone, this is my meniscus tear research presentation. The reason why I wanted to do my research presentation on the meniscus was because I had a injury last year and we couldn't figure out what was wrong, so I really wanted to learn more about the knee area. The current anatomy, there are 3 bones that meet to form your knee joint, which is your thigh bone, your femur, your shin bone, which is your tibia, and the kneecap, which is your patella. The meniscus is 2 pieces of cartilage that are acting as shock absorbers between your femur and your tibia. They're tough and rubbery to help stabilize the knee joint. And on the right hand side of the bottom picture, you can actually see the meniscus tear. But on the next slide, you'll be able to see a better picture. You can see the patella, the tibia, the normal meniscus and the torn. You can see the lateral and the medial side of the meniscus. And on the right hand picture, you can see where it's torn. Evaluation. First, you will discuss the symptoms and medical history with your athlete. Ask how it happened and if they heard any pops or felt any pops or any sounds during their activity. Then you will check for tenderness where the meniscus should be. The McMurray test is the bend of your knee, then straightening it, and then rotating it. And with positive tests, you will hear clicking while doing the movements. Next, I wanted to show a little video of how the McMurray test is actually done.
McMurray's test involves full flexion, valgus, and rotation, or full flexion, internal rotation, and a varus force, moving from flexion to extension. So that's McMurray's test.
The second part of evaluation is the imaging test. Some doctors may order tests to detect other knee problems with the same symptoms. X-rays, they won't show the meniscus tear, but they may show other reasons why your knee is hurting. And MRIs, they create good images for soft tissues like your meniscus. Some mechanisms. The medial meniscus is injured more frequently than the lateral meniscus. It's usually done with rotational forces directed to a flexed knee. An ACL tear often pairs with a medial meniscus tear, and this is when the foot is planted and the femur is rotated. It can result in a torn medial meniscus. This picture is about all different kinds of tears in the meniscus. So the radial tear, which is a small and large, flap tears, and all different kinds. Next is treatment. Depending on the type of tear it is and the size and location, treatment can be different for every athlete. The red zone means that it may heal on its own. The white zone, it can't heal on its own. The cartilage is worn and thin, so the pieces can't grow back together. So during surgery, they will trim away the cartilage. For non-surgical treatments, it's called RICE, and it means rest, which is take a break, ice pack for 20 minutes multiple times a day. Compression is to help prevent swelling and blood loss, and evaluate to help reduce swelling. They say to take aspirin and ibuprofen because that will help reduce the swelling in your knee. For rehab, for everyone's goal is to get back on the field or track or whatever it is. They want to get your full range of motion back. Some physical therapy exercises is knee range of motion exercises, quad exercises, straight leg raises, balance. Before it cut off, I think I was on the physical therapy, and it was different kinds of exercises that you can do, which is knee range of motion exercises, quad exercises, straight leg raises, balance exercises, and just going on a bike just to try to get the range of motion back in your knee. Some strengthening exercises is targeting your quads and your hamstring muscles. Active athletes will return in about a week after their surgery. Non-active athletes or people will return in about 6 weeks, and it all depends how fast you come back, and that's all depending on how hard you work with your physical therapist. The last slide is different rehab exercises, and that's knee extensions, heel slides, calf stretches, hamstring stretch, straight leg raises, prone hip extension, clam exercises. And there's also one that you can use like resistance bands on to go from side to side and to go back and forth. And my sources, and that is all. Thank you.